I hope everyone's having a very good afternoon. Certainly would like to welcome our media partners to the Caddo Parish School Board. So thankful that you're here to help us as we do a press release today around factors as we go into the Thanksgiving weekend, into what will be probably the most unique Thanksgiving experience that we've ever had. I certainly would like to start off by thanking our medical professionals for being with us today. We have Dr. Martha White, we have Dr. Van Cherry, as well as Dr. Bokimi, who are here today. And I remember that they have worked with us every step of the way as we have developed our plan as to how do we educate children in the midst of a medical pandemic. I remember in March, I was actually away at a conference, and Mr. Burden, our chief academic officer, met with them and called and told me that he had just met with them, and they think this thing called COVID-19 is a bigger deal than we anticipate. I remember wondering then, well, maybe it'll be like H1N1. It'll be a big deal today, but it quickly will progress through the cycles and we'll be fine. Nevertheless, I remember when we closed schools on March 13th, we were 1 week before our spring break. And I remember then I thought that, well, maybe we'll just be out this week plus spring break, and surely we'll have a cure or a vaccine or whatever you'd like to call it for this COVID-19, coronavirus, as we were calling it at that time. Nevertheless, as you know, that did not happen. And even as we approach this Thanksgiving season, we're still dealing with some of the effects of this virus. So really thank our medical professionals for being here today to add that medical opinion around the science around this as we talk about things that we need our parish, our community to do as we go into this Thanksgiving season. Certainly would like to take this time also to thank our board members that are here today, Board President Mary Trammell, Board Member Tony Nation, as well as Board Member Dr. Benita Dozart. So thankful for them and all of our board members. We truly could not have seen the great successes that we have seen as a school system had it not been for the support of our board. Would be remiss if I did not thank my staff, my senior staff, several of my chiefs, as well as my executive directors in the room today. Thank you to all of them. What I will tell you is that the thing about them is that even as we transition from in-person learning on March 13th, their jobs never stop. There's been so many hours of work that has gone into preparing to shift the school system at first to a virtual learning platform, but then to look at opening a school system that is prepared to pivot to an online learning platform at the drop of a dime. What we're here today, though, is to talk about some of those things that we need to do if we are to continue to have in-person learning. I know there's been a lot of conversation on our social media scene around when will we pivot back to virtual learning. And our goal is that we will not pivot back to a complete virtual learning model. Our goal is that we will look at case-by-case basis and make those necessary determinations as to what we need to do. One thing that we're really excited about and really want to take this opportunity to thank our communities, whether you are a student or a parent, for the wonderful job that we have done in mitigating the virus. We are happy to report that schools are not those super spreader events. In fact, we boast a positivity rate of under 1% for both students and staff. In fact, our student positivity rate is about 1.2%. So we are not seeing the schools being those super spreader events. However, I think it's important to note, as we've returned from things like fall break and also from Halloween, we did see increases that are concerning to us. I think we all know that the Thanksgiving holiday is a time that's pretty much devoted to spending time with family and friends. Generally, families travel. Generally, people meet in large gatherings. And what I stand here today to tell you is that this unique Thanksgiving is not the time to do that. A lot of talk in the media is around the vaccines right around the corner, or that we will have a vaccine soon. What I tell you, though, is that even though that may be true, that around the corner won't be until probably summer for many of our citizens. And our medical experts will certainly speak to that today. In that respect, it's important that we remember this is not the time to let your guard down. This is not the time where we need to engage in large gatherings. This is not the time when we don't need to make sure that we're not doing those things like sleepovers, those things like friends gathering to go to the mall together. This is not the time that we do those things that will increase the presence of the virus when we return to school on November 30th. Our goal, again, is to continue to have in-person learning. However, we want to do that in the safest environment that we possibly can. And that means that we as a community, we as parents, we as students, we as educators are going to have to make some difficult decisions over the holiday and look at what are those non-traditional ways that we can celebrate, enjoy family, but yet not be in situations that increase the spread of the virus. What I'd like to do now is, before I come back and talk about some things that we will do as a school system, I'd like to invite our medical professionals to give a few comments around, our performance as a community, maybe something around the virus, or whatever they would like to bring that they feel our stakeholders need to know as we transition into this Thanksgiving holiday. Certainly would like to start, I would say ladies first, but certainly someone who is a daily conversation either with my office or with Mary Woods in the Office of Strategic Initiatives around those things that we are doing in our system. And she has just been a jewel to our community, and just really happy to have her here as a friend, also as an incredible medical professional, and that's Dr. White. If you'd like to come at this time, Dr. White, and I'll let you invite your friends up in whichever order you see fit. And I'll come back at the end, and we'll be available, of course, for questions too. Dr. White.
Thank you, Dr. Goree. You know, I come to you again. Seems like I talked to you guys a lot lately. And really what I want to ask of you and of everybody watching is to consider what it is that you want. What is it that you want to see happen in our community? You know, if you want to see us moving more and more forwards towards getting near normalcy again, what we consider normalcy, then we know what we need to do. We've done it before. We need to wear our mask. We need to social distance. We need to not have large gatherings, even though we can. If we can't social distance in those gatherings, we need to not hold them. We need to not attend them. If you go to a restaurant or you go to a gathering and they're not masking or requiring that of the people there, you need to leave. Don't patronize them. Don't attend the event. Make them see that that's not acceptable behavior. Because what we're seeing is our community has a very high disease burden. Shreveport-Bossier, and actually all of my parishes in the northwest corner, but especially Caddo and Bossier, have really never plateaued at a low number. We stayed high. So if we look at like our hospitalization rates, we were always in the upper 100s, 160, 180, 200 people in the hospital every day with COVID, whereas New Orleans had dropped to 60 a day. Lafayette 40, Baton Rouge 40. We never made that drop. So while we did plateau and we were kind of staying around the same number, we never went to a lower number. Well, now the entire state is climbing, including us, but we're climbing from a higher number because we never took that big step back like we had hoped. We in this community, when we got to phase 3, when we started playing competitive sports, people came back to school full time. People started opening, their businesses again. We stopped doing what we know works. We were the best in the state. This region was noticed by the governor, by the head of LDH, by the head of public health for being on the best track in the state in early phase 2. And now here we have the highest number of cases in the state. We have the highest number of people in the hospital in the state. We have high percent positivities in our parishes. So we need to do what we know works. And we can do it. We can make it work again. We can get back on track. Nobody wants to take step backwards. We all want to keep moving forward. And we have this vaccine. Dr. Vancherry and Dr. Bocchini can talk to you about what they're seeing. But as that comes out, it's going to come out in phases. Different priorities groups will get it first. It's going to be a while before we truly have a herd immunity from that vaccine. So that's not going to be our answer right this minute. Down the line, it's really going to help us. But right now, we've got to do what we know works right now. So let's keep our kids in school. Let's keep them having the events that they want to have, but let's do it in the right way. And y'all know what that is. So I'm going to bring up Dr. Bocchini, Dr. Joe Bocchini. He is an amazing pediatrician who is well known in our community, and he's going to talk to you about what he's been seeing in regards to the virus.
Good afternoon. I think Dr. White very concisely told you the important information that everybody needs to understand. Right now, if you go back 1 month around the state, we had around 500, a little over 500 people hospitalized with COVID infections. Right now, it's nearly 1,000. So we've actually doubled the number of admissions to the hospital within the past month. So that indicates, because hospitalizations are sort of the last evidence of increasing outbreak or increasing viral circulation, it means that the virus is heavily circulating within the communities. And she's right, our area has had a significant increase in those hospitalizations. And last week, just looking at the Willis-Knighton data, our positivity rate was over 15%. So of the patients that were tested in the Willis-Knighton system. So it's very clear we have a high degree of activity within our community. She's also right that the most important way we can prevent this infection is a well-established approach to prevent the transmission of respiratory disease, and that is staying 6 feet away or more, limiting the number of exposures that you have, and wearing a mask routinely when you can't keep that social distancing and when you're in an indoors environment. So it's really important that we follow those because, as she said, the vaccine is very exciting. It looks like we're going to have at least 2 very effective vaccines, and in addition, more vaccines coming, but it's going to take time for them to meet the FDA requirements for licensure and then to be distributed amongst the public, and therefore it will be many, many months before we have the vaccine available enough to promote and develop the herd immunity that's necessary to prevent viral spread in the community. So I think right now, with a week of vacation coming up, it's really important that we re-emphasize the principles that we know will control this virus within our community, within families. And so, although Thanksgiving is really a family time, it's really important that this Thanksgiving we change the rules and we pay attention to staying only within your immediate family, that we minimize travel, that we minimize large groups, and that we pay attention to the guidelines from the state and from the CDC. The CDC has just published a new set of very specific guidelines that families can use to try and make Thanksgiving safe. So I'll stop there and turn this over to Dr. Vancheri, and then certainly we'll all be available for questions. Thank you.
Thank you, Dr. Bocchini and Dr. White and Dr. Goree. It's a pleasure to be here. So my messages are going to focus on 2 things. Number one is if we could hypothetically stop all transmission right now of COVID, what would happen? We would still see hospitalizations go up for the next several weeks. We would still see deaths accumulate after that due to COVID, okay? Because the people who will be in the hospital next week are already getting sick now. Okay? And the people who are going to die of COVID in 2 weeks are already the ones getting sick now. What's challenging about this virus, there are several things. Number one, it's new. We're still learning new things about it every day that are impressive to us as scientists and as physicians. So we're still learning an awful lot. Another thing that's very impressive is the high rates of people who have no symptoms at all with this virus. It's higher than the rates of flu asymptomatic spreading. Okay, so those people with no symptoms can still spread the virus. What that means is if there are 30 people in a room, that a significant number may have COVID infection and not know it, even though they have no symptoms. So you can't wait for symptoms to say, okay, now I have a cold, or now I'm sick, I have a runny nose or fever, and I'm going to stay home. Okay, that's not an effective strategy like it is in other times. And then, you know, the third thing that's really important to know, and as Dr. Bocchini alluded to, is the vaccines data is looking very, very good. but those are still months away. And the first tier of use of the vaccines will be in healthcare professionals and those at highest risk, people who work in nursing homes. The vaccines look to be very safe and effective even in older folks, which is different than flu vaccines, but it's still a good ways away. So my emphasis is, number one, as they've said, do the right thing. Make the harder decision sometimes and stay home. For our teenagers, this is very difficult. Teenagers and young adults, they are social creatures, if I can refer to them as that. And they like to be together. And many of them are having some mental health issues because of that isolation. So parents need to pay attention to their teenagers and young adults, be in contact with them. Let them use the social media and other things to be in contact with their friends, even when they can't be together for sleepovers, for hangouts, and other things. Okay? All of those things, the mental health of our teenagers and young adults is really important, and we're seeing more data about that and the importance of families supporting our teenagers. I'm also hearing from colleagues that they've made a decision to not have the extended family over for Thanksgiving, and every one of them who they've contacted says, "Oh, thank you. I was so worried. I thought you'd be offended if we said we weren't going to come." But they are happy that others are helping make the right decisions. Okay, so we all can bear with each other. We can forgive each other if we inadvertently insult each other by not coming to Thanksgiving. But it's not personal. It's about protecting ourselves and protecting the ones we love. Those are really critical things. And as the others have said, we can get through this by doing very simple things. Others have said it's the 3 W's. Wear your mask, watch your distance, and wash your hands. So that's an easy way to remember the things that really are making a difference. And the vaccines will be here when they get here. They will hopefully be very effective. They will help change the tide. But we're still not at, in Winston Churchill's words, we're not at the end of the beginning yet. Okay? We're still got a long ways to go with this pandemic. It is a worldwide crisis. We all have to work together. We will win as a team. We will work together as a team and win as a team. So keep up the good work. A lot of places are in much worse shape than we are. So unfortunately for them, good for us, but we've got work to do as well. Our numbers continue to creep up, and the more we do now, the more we will prevent deaths from occurring between Thanksgiving and Christmas. And none of us want to have that happen. So thank you.
I'm going to tell you a real quick story, and then I'm going to let Dr. Goree get on to the business that he has to get on to. But as we think about whether we're going to get together for Thanksgiving, I'm going to tell you a story about one of my nurses. Bright, intelligent, wonderful nurse. Has a very large family. They get together every Sunday after church for lunch. Done it since March. We're lucky. They got away with it every Sunday since March. At the end of July, beginning of August, they met one more time. They had a wonderful lunch. 9 of them ended up very sick with COVID, 3 of them in the hospital, and 1 of them died, all from having lunch together after church. And she looked at me with tears in her eyes and said, "But Dr. White, it's just my family," right? We all think that those people we're together with so much during the day are family, but we're all out in the community, and each of us brings that community home with us every night. That's why you need to wash your hands. That's why you need to social distance. That's why you need to wear your mask, not just for the people that you're going around, but for what you might bring home to your family. Lovely family. None of them deserve that. She had her mother, her father, her husband, all in the hospital at one time, and her father didn't come home. So realize that it's a decision that you have to make for 1 year. It's one Thanksgiving. It's one dinner. So is that going to affect your life forever? Or are you going to be lucky? Who knows? She thought she was lucky. She was lucky for months, right? So I just wanted to put that out there for you.
Thank you very much. I do want to also, of course, welcome board member Christine Thorpe has stepped in. Want to certainly welcome her. be a part of this conversation today. Also, I have to thank our wonderful supervisor of nurses, Ms. Catherine Lassiter. Catherine has been a rock star throughout the summer and really helping us to navigate this, working very closely, of course, with Ms. Woolfolk and the HR team around making decisions around human capital, which is always some of the most challenging decisions you can make. So a huge thanks to Ms. Woolfolk and her team as well for their support. You know, one thing I'd like to stress is that, you know, when I speak of Catherine and Mary from the Strategic Initiative Office, we've been beat up a lot. And again, there's a lot of people in the community who assume we want to control your life. And it's not that we want to control your life. What we want to do is create the safest environment so we can continue the educational progress of children in the midst of a pandemic. One thing we know for sure is that the world is not going to stop and wait on Caddo Parish. So it's important that we do everything we can to advocate for the best educational opportunities that we possibly can. You know, when Dr. White spoke, she spoke about the numbers and about how our numbers are not low. Our numbers are increasing. Our numbers have been at a steady number that we don't find to be good. That's why it's important that we come and stress these things to you. Now, as you know, Dr. Van Cherry has spoke about the vaccine and that coming, and we appreciate that. But Dr. Van Cherry and Dr. Bokimi both stressed that that's not the answer for today. That's not the answer probably for April, probably not for May. That's something that's to come in the future. Even as we begin to accept the vaccine, even as people begin to take the vaccine, there's still that herd immunity that we have to work towards to where it is safe to be in an environment and to feel comfortable that you won't catch the virus. Now, in that respect, as a school system, and where I ask our media partners to work with us, is that next week we will start a social media campaign around those things that we really need to see families do if we're going to see a decrease in the percentage of virus present when we return to school on November 30th. Those things include those very simple things. Wear your mask, 6 feet of distance, as well as those things around washing your hands and making sure that you're stressing hand hygiene in your families. We believe if we do those things, if we avoid those large gatherings, if we make those difficult decisions, we do believe we will be able to successfully come back after Thanksgiving and do those 3 weeks and then go into our Christmas break. And again, we'll talk about January at such time as that. You know, one thing before I take questions that I do want to stress is that I heard a documentary that spoke about Thanksgiving could greatly affect your Christmas. Because if you think about, Dr. Bokimi spoke about how those persons who are going to be sick at Thanksgiving, at Christmas, are probably going to be contracting the virus at or around Thanksgiving or around that first week. And you're going to see those delays. And we certainly want to make sure that we go into Thanksgiving healthy and do everything we can to have a Merry Christmas. And that generally means that we don't want to be sick. So let's make sure that we're doing everything we can to ensure that we are not spreading or not encouraging the spreading of the virus as we go into this Thanksgiving holiday. At this time, we would like to open the floor up for any questions that you may have of me or any of the doctors.
Okay.
Timmy?
A lot of the questions are coming from the athletes and athletic program, stating that most of the choices you have to make or closing the schools or suspend school for a while is coming from the sports, department. What is going on with that, or what can you say about that?
Right. What I can tell you is that, our Louisiana High School Athletic Association did make a decision to move forward with sports. I do think a lot of the questions around some of the mental capacity and mental support of students played roles in that. Again, I can't speak to exactly why those decisions were made, but what I can tell you is that we are making every mitigating factor, every mitigating opportunity we can. We're taking advantage of that as students are participating in athletics. We are wearing a mask. We are, when necessary, if it's time to quarantine, we will quarantine a whole football team. We have done that. So we are taking those things seriously. But again, the thing we think we can stress is that as we go into this continue to play sports, that we take every safety opportunity that we can. Did any of you want to add anything?
So the answers around athletics and competitive athletics are complicated. And the major message is that the more exposure any one of us has, the higher our risk goes up, right? That exposure is related to distance that we are from people and number of people that we're in. A crowded area is much higher risk than a non-crowded area. And so the decisions about high school athletics in particular are very complicated. They have economic implications as well as social implications for our students. And some of them, if they're vying for scholarships, then they're thinking about their future and that COVID is ruining their future. And as a parent, I take those things very seriously, because for some, those scholarships are key. The other thing I think that I would point out, and I've heard it said by a lot of people that they live for football, they live for baseball, and parents saying they live for football and baseball on Friday night or Saturdays. But the opposite is not true. I don't think they're willing to die for football or to put their grandmother or grandfather or other loved ones in jeopardy for football or baseball. And that's not going to be a common occurrence. But what we have no ability to predict that occurrence. Okay? And so when you start to balance those things, a little sacrifice now is what will save lives going forward. And that's in Thanksgiving dinner, that's in athletic events, that's in church gatherings and all of those things. We really have to be prudent in making those decisions and help people make the best decision they can.
One final question.
Sure.
Okay, I know there's some places you can get tested and the results will come back within like 30 minutes.
Mm-hmm.
Do you guys think we can implement that in the process of the athletes getting tested every day at practice? Because Dr. White stated, we all go home to our families, then we come back. So I think that can kind of eliminate some of the risk of people catching it and spreading it if everyone can get tested daily. But I know it probably costs a lot, but I'm not sure.
Yes, so testing is one strategy to help control and identify where is virus in the community and ultimately control it. The tests that are available that are rapid tests are designed for people who are having symptoms. They're not designed and not ideal to implement for people who are not having symptoms. They're not good for ruling out COVID, right? They confirm COVID when you're sick. And so that's part of the dilemma. Those tests sound very attractive, but from a medical and scientific standpoint, that's not how they're designed to be used. And so if we could use a highly reliable test and daily testing in any venue, schools, athletics, airports, and all those things, that would give us a better encouragement of reduction of risk. Absolutely. There's no two ways about it. But those strategies are not available for widespread use. And again, we have to really think about how they're designed to be used and are we using them appropriately. There are a lot of complicating things there. But your point is well taken. If we had, under ideal circumstances, we could test everybody very reliable by just in the morning you wake up and swab your nose or spit in a cup and dip a stick into it like you do any other test that you get from the pharmacy, that would be great. But we don't have that technology at this point available. Okay.
Any other questions? Yes. Right. One thing that Dr. White said that really resonated with me is that I think we too, in this case, have to be our brother's keeper too. And I think that if there are opportunities where we can help someone along the way, we need to certainly do that. If we know of family members or friends that are planning those large gatherings, we need to discourage that behavior. I think at the same time, if we go to a business or somewhere where they're not exercising the appropriate mitigations, we need to hold them accountable for that as we walk out of the door and let them know that we're holding them accountable for that. One thing that I do think, too, is still an advantage for families is that we still do have our full virtual option. So a family that is just really not comfortable with the in-person setting still does have a full virtual opportunity available to all of the children in our parish. So I do think that's one safety precaution that we have in place for parents. I think it's important to know, though, at the same time, that teachers don't have that luxury. So I do think that's why we must continue to push to make sure that all of those mitigating efforts are in place at every turn that we can. Dr. White?
The only thing I'll add to that is that, you know, I've been saying for weeks now that the schools are really the safest place for our children. They are really ensuring that our children, their teachers, the other staff in the school are following these guidelines. They're making them wear masks, they're having them social distance, they are doing all the things they can. Now, sometimes your child may be put on quarantine because someone was sick in the classroom, didn't know it, was there for a day or so prior to knowing they were sick, right? And then they might have exposed them. The good news is very rarely are we seeing a transmission in that case. We don't always know because not everybody gets tested who goes on quarantine. We recommend people test around day 5 to 7 if they're on quarantine just to see where they are. But we really don't know unless people test kind of more than once during their quarantine to see if they might have developed the disease. And that's okay. They don't have to test, but so we don't have a perfect picture. But what we do know is there's not much spread, and whatever spread there might be within that small group of quarantined children or adults is not spreading beyond that. So we don't have someone that we missed or another ring that we have to isolate from there. So really, your children are really safe at school. They're doing a wonderful job. It's not perfect, but nothing is. And so I think that, I hope that that will help reassure them.
And I have one more question. This is Superintendent Goree. So in the event, because I know there's still a lot of speculation from parents that, oh, well, maybe they can go on quarantine after break just to kind of give them some space. Can you debunk that for me? So
Thank you.
November 30th, they're still going back to school, even if you see a surge over the holidays.
Absolutely. So what we're doing and the way we'll manage this, and I've heard two things today that I think have been pretty widespread, and I think our friend social media has helped with the spread, is that November 30th will go full virtual and that school will end in April. Both of those are 100% rumors. A lot of questions around the governor's office stepping in and closing schools. That's a rumor. None of those things are true, and those things are not in our plan of action. Our plan is that we will return to school on November 30th, and we will continue to monitor each school and each case on a case-by-case basis. Now, does that mean that there could be a situation where a school will have high numbers, whether that's in staff or student, and we choose to transition that school to the virtual learning platform? That's quite possible, but there is no intention of transferring our entire system to the virtual learning platform. And I thank you for that question and making it real plain, because I do think that's important. You can.
So in terms of the question of whether students should quarantine after November 30th, they're out of school for 9 days. That is effectively a good quarantine period, right? That's the time to reduce the activity, not to increase the activity and spread in the community, right? So that's the time to hunker down, stay home, be together, be very thankful for health, so that come November 30th, you don't have to go into quarantine, okay?
You have a question? Yes, sir.
I was saying something in here. So we were talking about the numbers increasing, Dr. White. Is that in Caddo and Bossier Parish, or is it in the Northwest Louisiana region?
So numbers are increasing, period, in all of the region, which are my 9 parishes in the northwest corner. When I say that 200-plus number, that's for that entire, all the people hospitalized for COVID in those 9 parishes. Now, by far, that is, the majority is going to be in Shreveport and the Bossier, but it is for all of them. If you look at percent positivity, we have significant issues in Natchitoches, Red River, Caddo, Bossier, and we're seeing, you know, some climb in Webster, and DeSoto kind of goes up and down. So, you know, all of our parishes are having some issues.
Gotcha. And I was reading a press release earlier, and it was saying that if families are considering to still gather and practice social distancing, to do so outside.
Right, and on that press release, and I encourage you to also release that, there is a link to the CDC site where they are giving some recommendations as to how families can safely gather. Outside, of course, is safer than doing anything inside because of the air circulation. I think also a lot of conversation around Zoom meetings and Zoom family dinners. I just think people have to be really creative and look at what are those ways they can creatively be thankful and show appreciation and be with their loved ones, but yet not spread the virus. And we've had quite a few months to practice this, so hopefully we'll pull back on some of that April behavior and see if we can see the declines that we created in the spring, and certainly the declines that we created when we implemented the mask mandate. That's it? Okay. Well, again, thank you so much for your time and attention today. Again, we do appreciate you helping us to get the information out. One thing that Dr. White said is that Caddo Parish and Shreveport is the hotbed if you look at where we are as a community. So thank you for helping us to get the message out. We are Caddo. You can jump in. Yes, sir.
I'm sorry. One last thing. We haven't talked about flu vaccines, but it's incredibly important each year to get influenza vaccine. What's that? Right. So every year it's really important that everybody gets their flu vaccine, but this year it's even more important. We do not want high incidence of COVID infections and have a concomitant influenza outbreak at the same time. So one, if you haven't gotten your flu shot, we've been lucky so far. The flu season has not yet started. It's a good time to get vaccine. And then the second thing is that in the winter months, hospitals tend to get full. And so if we have a lot of COVID patients, in addition to the sickness and the outcome of COVID infections, makes it more difficult for hospitals to treat the usual things that happen during the winter. So we want to keep capacity at hospitals high so we can deal with the usual things that happen as well. So in addition to individuals protecting each other, it's also important to maintain the opportunity to take care of other things that normally happen to people during the winter and actually throughout the year.